Okay, we want to welcome everyone to our initial uh, expert advice live session. It's Sunday evening on April 6th, and we are looking forward to having folks join us to ask some questions. With us is Emil Chuck, who is Director of Advising Services for the Health Professional Student Association, which is the publishers of the Student Doctor Network. And he's going to talk a little bit about situational judgment tests and multi-mini interviews. And then once he does that, he will be answering your questions live. So you can put those questions in to Facebook, to LinkedIn, or to YouTube, and we'll be able to answer those live on the live stream. So we'll go ahead and get started with the first couple of questions that we have prepared, and then we'll take some of your questions. So the first question is, why have situational judgment tests become part of the admissions process?
So yes, thanks, Laura. And anyone who's watching this, thank you so much for joining us for this expert answers live session. So we're here to answer your questions about situational judgment tests and why they've become a part of our admissions process, not just to medical school, but a lot of other health professions programs. I think one of the things that most of us who have dealt in the admissions arena have realized is that we have a lot of opportunities to assess applicants based on the things that they know, based on the things, how they acquire information, and basically if anyone is scientifically ready for the complex language that comes with any health profession. But one of the things that we haven't done so well over the many, many years of doing admissions is really get a sense of who you are and how you interact with potential patients or other teammates on a healthcare team. So situational judgment tests have actually been part of the educational process and training and licensure of health professions trainees for quite a long period of time. It's been about over 50 years where we basically put trainees or candidates in a room where they work with simulated patients who are sick, and the individual candidates are assessed on how they communicate with the patients and how they go about with the process of handling a consultation appointment or any sort of challenges that a particular interaction with the patient might entail. That's important for anyone to get licensure. There is a way to standardize that process, and basically for about 50 years we have what's been called the objective standardized clinical exam. Again, that is a general format, which is essentially a situational judgment test that focuses on your clinical knowledge as well as your scientific knowledge and your interpersonal skills that you need in order for you to be effective as a future healthcare provider. So situational judgment tests have actually been part of the educational process for many health professions programs for a very long period of time because it's an essential part of your licensure. So what happened about 25, 30 years ago is that many of the educators basically took many of the general concepts of the the OSCE, the Objective Structural Clinical Exam, and created what we call the multiple mini interview. So you might be familiar with multiple mini interviews already, and they've been part of the admissions process at least 20, if not 30 years, where you may be put into various different rooms at a short period of time, where you interact or engage with someone who is an evaluator or an assessor to your situation. It could be an actor, it could be a faculty member, it could be a student, it could be anybody. So what situational judgment tests do is it takes the in-person experience of being part of a multiple mini interview and puts it in an online platform. Or that's what we're calling situational judgment tests for what it's worth. So in the same way that the MCAT is used to evaluate your scientific knowledge, situational judgment tests are meant to get a better idea of how you behave and what your skills are when it comes to interacting with other people, whether they be your teammates or they would be your future patients. And so it's become part of the admissions process just to make sure that you have a very good understanding of what those soft skills really are. and many admissions teams want to get a better sense of, a measurable sense of how those soft skills really compare against other applicants, and does it meet a certain expectation that we want to have for incoming students. So situational judgment tests have been part of the admissions process, at least in the US side, for about, I think it's been a little bit over a decade, maybe close to about 15 years, where we started off with a lot of schools in Canada in the medical school realm to take part in a situational judgment test based that was implemented on a computer or a computer-based exam. It's now known as Casper, and it is now run by a company known as Acuity Insights. It's the same company, it's just gone through a number of iterations regarding its name. So the Casper exam is actually a platform that is administered not just to medical schools in Canada, but now obviously in the United States, dental programs, pharmacy programs, physician assistant programs, also within the United States, and in several other countries around the world. So this is not just one simple test. It's basically what I will term is a platform that is intended to measure your competencies in soft skills, in communication, in problem solving. Now, since about 2015, the AAMC has also been very interested in developing its own situational judgment tests, focused predominantly for anybody who wants to go to medical school. So they have been developing their own situational judgment tests since about 2017, 2018. And it finally came out of the pilot stage about 3 years ago and became branded as the Preview Professional Readiness Exam. And so the Preview exam has been available to medical schools, both on the MD as well as the DO side, for the last 3 years out of pilot. And I think a lot of schools are, still remain a little skeptical, and they want to see exactly what information is gained from the testing the test results that we get from the Preview exam. A lot of other people are still using Casper, and they want to figure out, well, is there one that's better than the other? Which one gives a little bit more predictive validity to what we anticipate seeing later on if we admit them as students? So it's definitely become part of the admissions process because we realize that these soft skills are very important, and we want to make sure that you have a very good grasp of what they are before starting medical school. We're basically one of the latecomers when it comes to having it as part of the admissions process. It's been part of the admissions process to getting into medical school in so many other countries, including in England and also Australia and New Zealand. So we're a little bit late to the process on our own, but it's something that I think universally and across the globe is something that is already a part of the admissions process. We're just a little late.
Thanks for breaking that all down. I think we actually answered a couple of the questions that we had listed here. So switching gears a little bit, when does it make sense for students to be taking situational judgment tests? And again, I also wanted to remind people, if you want to put comments into the if you put your questions into the comments on the live stream, then we will take those questions live. So, but if you could go ahead and talk a little bit about the timing for situational judgment tests.
Sure. So for this conversation, we're really talking predominantly about the two main players for most pre-health admissions processes, which is the Acuity Insights Casper exam and the AAMC Preview exam. And when people should be taking the situational judgment tests really depends a little bit on either of these tests, because both of them have different ways in which they manage their results. And so what I like to tell people is, pay attention to what the test makers say is, in terms of like how long your scores are valid, and then make a decision based on that. I think most people find out that they need to take it as a situational judgment test when they are developing their school list. And I know we're going to talk about school lists next week, but when you make a school list, most people hopefully find out early on in the process that they need to prepare for a situational judgment test. Otherwise, it's perfectly fine. A lot of schools, if they are new adopters, may wind up telling their applicants, thanks for submitting your primary application. By the way, we just recently decided we would require you to take this situational judgment test. So in a lot of cases, when you should be taking tests depends on when the school wants you to take them. But there are opportunities for you to take the exam earlier than the actual open date for submitting your primary application if you happen to already have a good idea of what your school list is and if a certain number of schools require either Casper or Preview in advance. Now, neither of the test makers really give an explicit date or explicit advice on when you should take the exam. For all they want to know, they just want to make sure that you take it and that you address whatever questions they have that you have about taking the exam. What we found is that a lot of people who applied last cycle wanted to take the situational judgment test relatively early in the cycle. So like for Casper, once the dates really are revealed, many people are taking Casper relatively early, like in the months of May, June, and maybe a little bit into July. What we find, and that's perfectly fine. We see people are mostly taking it then, but you can take it in August or September, all the way out to whatever the last date available for your school list happens to be, which I think in a lot of cases would be late September or maybe late October. It really depends on the school and it depends on the program. So I mentioned this because, if it's medicine and dentistry, usually it'll be, those dates will be posted probably as beginning this month. If you go to the Casper Acuity Insights website and you register for an exam and so forth. Normally I would suggest giving yourself about a month after you register for the exam, at least a month to take the assessment a little bit later, and just that you're as prepared as possible to take it. So in terms of the timing, that's usually when we see for Casper. For Preview, when we did our survey of applicants last year for the fall 2024 survey, many of the respondents who said they took Preview really wound up taking Preview for the most part in the month of June. The month of June seems to have them, I think, two or three different testing windows that occur then, whereas most of the rest of the months, if you're starting April all the way out through September, usually have maybe one testing window as a result. So maybe what we're seeing is that most people are taking it in July, kind of as an artifact of the fact that you can take it 2 times or maybe even 3 times during the month of July. But basically still the message is still pretty clear that if you know that a school that is on your list requires you to take Preview, you just have to kind of plan it when you have to take it. And most people are taking it during the month of June. Now, why are they taking it this relatively early in the cycle? There is I guess I will call it a myth, if you will, because I haven't gotten any verification about this. There's generally a myth that everyone believes that, get your Casper and your Preview scores in. It's part of your overall application, and the scores need to be at least received in order for your whole entire file to be reviewed for eligibility for an interview. And so I think that's one of the reasons why a lot of people are taking the exams as early as they possibly can if they know they have to take it. But there really is no evidence that's out there that says that if you took your Preview or Casper exam relatively later in the summer, that it somehow or another set your application back. We don't have any information about that, and the schools themselves don't give any it can neither confirm nor deny that actually is the case. So I think that's the best we can do in general about when one should take the SJTs. Basically, as early as you probably can during the start of the cycle, as long as you don't have to lay it on top of taking an MCAT at the same time and so forth. It doesn't require a lot of preparation, but on the other hand, you want to still remain focused on all the tasks you need to do during the application process.
Great. That's really detailed. And I think the question that a lot of students have is what happens, you've gone through the process of, it's supposed to be measuring your soft skills, how you work with people, and when's a good time to take it. Well, what happens once you take this test, and what did the admissions offices do with those results that come in?
So obviously that's a big black box, and a lot of the admissions offices still, I would hope, would be a little more forthcoming in due time when it comes to looking at SJT results and making decisions. Some schools are saying that they like to see the results and sort of incorporate it into their entire holistic review process. When they look at an applicant, they want to make sure they have whatever metrics available to them regarding your grade point average, regarding your test scores, MCAT, DAT, whatever else. And then they see how well you performed on a situational judgment test to get more or less a complete picture and perhaps put it in balance in terms of saying, hey, this is how well you did in terms of your academics. This is how well you did on your entrance exam. This is how well you did on a standardized, competency-based, behavioral test that we really are interested in. And the nice part about those situational judgment tests is that there's a degree of validity and predictability that has come with the design of those tests. So people who the programs that are using those tests have done they've either accepted the information from the test makers, or they've done their own surveys to see that, hey, a result on Casper a positive result on Casper is associated with, say, less frequency when it comes to professionalism citations, or a better performance on some OSCE exam or prep exam that leads to licensure or something. So maybe they have their own reasons where they would look at that information at the point of screening an application to see, is this somebody that we feel we want to interview? And so whatever metric that they use, or whatever sorting, prioritizing that they use based on that information, a subset of schools will use it as part of the screening process. Now, that's not how everybody does it. So there is another group that will certainly look at those SJT results and maybe incorporate that and compare it to your interview scores, however you do them, whether it's a traditional interview, whether it's multiple mini interviews or whatever. They like to use that as a way to sort of complement whatever your in-person or virtual interview performance happens to be scored. So it's part of a discussion for an entire file deliberation to just say, okay, where should we put this applicant in terms of immediate eligibility for an offer, or do we put them on a wait list, and where on the wait list do we do that? Third, and there's still a third way that people can use SJT results, and one of them is to basically say, you want to make sure that maybe you have some people that you're not quite ready for an offer, or maybe you're kind of hedging on whether you could invite this person or give this person an offer, or this person needs to go on a wait list or something like that. When you have sort of the tiebreaker decisions, a lot of schools will basically use and compare SJT results to perhaps measure or at least make a judgment call on whether someone should be granted an interview, or be granted a higher priority spot on a wait list, or granted an offer. So in a lot of cases, people are relegating the scores, or a lot of admissions committees will relegate the scores to a very, very critical point when it comes to making decisions on candidates. So whatever happens, the people who make the tests do not dictate to any of the admissions teams how they use the scores, but they do realize that these test scores are very flexible in an admissions evaluation of a file. And so it can happen early, it can happen after your interview, it can happen late. And I wish there is more consistency about it, but that's one of the things that kind of makes the SJTs, I guess, useful and flexible as they are for the admissions teams. So hopefully I know that doesn't give you a definitive answer on how they use SJT results, but I hope it gives you an idea about how offices usually use those results as part of their holistic review process.
Hey, I want to hop on here because I'm not sure that my audio was getting recorded, and I've been trying to highlight that if you want to ask questions, please put them in the comments below, and we'll push them over. I'm Laura Turner. I'm the Executive Director for Health Professional Student Association, and I'm helping produce this. So it looks like we've got a question that has come through, so I will push this over to Dr. Chuck, and then I will hide myself back off the screen here. So here's the question.
Okay, so hello, I'm a bit confused. What is an example of an SJT? Is it just the Casper exam? Well, there's actually many different types of SJTs, but the two major players that are in play for U.S. health professions admissions are the Casper exam, which is run by Acuity Insights, which is a company based out of Toronto, Canada. The people who run the Acuity Insights team, this is one of many different platforms or one of many different online or computer-based tools that exist for people who are involved with health professions education. And one of the things that this SJT does is it helps people who use their platforms try to track people's individual competencies when it comes to ethics, when it comes to professionalism, when it comes to communication skills and whatever. It's an opportunity for one to be able to streamline a little bit of the measure of those metrics. And if someone were to use the rest of their platform tools, it really helps aligns with whatever the school is doing to address many of these competencies in their health professions program. So the Casper exam itself is designed as a situational judgment test in which respondents actually give a full answer, whether it is typed or it is given through a web camera. So it is an open response-based assessment, and essentially you are recorded during that period of time that you are asked to give a response. Those recordings are sent to essentially a panel of evaluators who will evaluate you. One evaluator looks at each one question that you answer. So if you have roughly, I believe it's 11 scenarios that you have questions that you have to answer, there are 11 different people that will evaluate your responses, as well as a bunch of other people's responses for comparison purposes. So your score comes from basically it's sort of a summation or an average, I'm not sure, but basically they calculate your overall score based on the 11 different judges that basically rule on your overall performance, and that gets converted into some sort of a statistical or scaled score that is then shared with the admissions team. The preview exam, which is another situational judgment test, is designed differently. It's designed as a multiple choice test, and basically it presents situations and a situation to you, and then some possible outcomes or possible choices that you make to respond to that situation. You are asked to rate the response to that situation as being an effective response or an ineffective response, with more extreme for very effective or very ineffective also coming into play. So it's basically a multiple choice test, as I mentioned. I think you go through about, I think it's 180 items, so it's about maybe 20 or so different scenarios. I got to look back at my notes on that. But you basically have a good bit of time to articulate whether you feel that a response would be effective in solving or resolving the issue or not. So there's a lot of different stuff that happens with situational judgment tests, and the design of the tests is different from one test versus the other in that sense. I hope I've answered your question, and if not, just follow up in the chat in whatever platform that you are using.
I threw another question in there about what common problems people have run into.
Okay. I wasn't sure. It's like, Laura, are you back on screen or not? So everybody, please indulge us. This is our first time to do this. So what are some of the common problems others have discussed about taking a situational judgment test? So about 3 years ago, certainly when the preview exam was launched, a lot of attention was paid to the testing experience for people who are taking Casper as well as for preview, and comparing between the two. Now, again, Casper's been around for a little bit over a decade, so we've been fielding a lot of those complaints over the years. We've had a number of other people write about their expertise in and make suggestions about preparing for Casper, including some of the challenges that many people have talked about. So for Casper, one of the most cited challenges that we ask people to prepare for is getting used to the timing. Previously, a lot of people will describe Casper less as a situational judgment test as much as it is likely more of a typing test, because you're given a certain amount of time to type in at that at that period of time, your answers to like 3 different prompt questions for every scenario, and so forth from there. So further back, the Casper exam was strictly just a typing exam, or at least it was a written exam where you had to type in your responses to all of the scenarios. About a few years ago, they made a change so that some of the scenarios were actually given, you were actually allowed to give vocal responses or verbal responses into your webcam, and it would be recorded and so forth. So they have been adapting to a lot of the challenges and a lot of the complaints that have come very early on. This year, we're really excited to hear that Acuity Insights has further made some changes to really focus a lot more on assessment of competencies and your actual answers, as opposed to the concern or the anxiety that comes for the fact that you have a limited amount of time to respond. While you still do have limited amount of time, and you do still have to manage that time, one of the things that the Acuity Insights team has done is, instead of 3 follow-up questions for many of the typed responses that they ask of you, they've actually reduced the number of prompts to 2. And they've also consequently reduced a little bit of the amount of time that you have to respond to both questions, from 5 minutes to about 3.5 minutes. But it's a little bit easier to kind of manage 2 questions in 3.5 minutes than 3 questions in 5. So one of the things for Casper, for sure, a lot of people just are recommending, make sure you manage your time well when it comes to structuring your answers, or when you're typing them in. That's probably the one thing that I think is most common for the Casper test takers. Now, for preview, what happened is that there were a lot of people who, at the first years after it came out of pilot, were very unfamiliar with the security protocols that are involved with administering the preview exam. So there were a lot of stories about many individuals who were going to be taking the exam where an external proctor came and basically reset a lot of the, locked down the security of your laptop or your computer to make sure you're not inappropriately accessing the internet to help come up with some answers, and so forth from there. There was a lot of people were very anxious when it came to this security of having somebody external come down and do some stuff with your computer. Whether the settings remained or did not remain after the whole testing experience was done, it still was very jarring, and it was pretty much a shock. So since then, the AAMC has asked the platform manager to develop a video to really go over the security protocols that happen when it comes to just getting used to the user interface, making sure you prepare your room properly so that it conforms to what the security expectations are, so that we know you're not, somehow or another, cheating on this exam, that no one can interrupt you, all of those sorts of things. So I would encourage you that if you were going to take the preview exam, to really go to the preview website, the AAMC preview website, and go over all of the details regarding the technical requirements of taking preview, and especially review the video that talks about the security protocols that you should expect once you take the exam. So those are some things that, at least for sure, are the most commonly discussed challenges that comes with taking the exams. But there's one other one that I do want to make sure you do pay attention to, and that is the issue of time zones. I think both of those exams, they tend to schedule their exams relative to the Eastern time zone. So if you're not in the Eastern time zone, you really need to pay attention to when you are scheduling your exam, and that you adjust for your own clocks. When you're going to need to be ready to take either of those exams when it needs to be. There have been way too many stories of people from different time zones that completely miscalculated or missed their own exam because they forgot that there's such a thing as a time zone difference. So those are just some of the things that we will say are some problems about the SJTs. So become familiar with the test, know about the technical details and some of the things that you need to concern yourself with regarding security and registration, and just make sure that make sure that you are as prepared as possible to take the test, and not necessarily be so worried about how well you do.
Okay, we got another question that has come in here from McKenna Smith, who asks, how do you suggest preparing for the Casper exam?
So there are a lot of articles that we have in the Student Doctor Network archive. I first of all will suggest that you certainly go and read them all in terms of how to prepare for your answers to those questions and how to prepare appropriately. I come from a mindset where I will ask, how do you prepare for multiple mini interviews? And so some of those suggestions overlap with how to prepare for Casper. Now, aside from all of the other advice that I just mentioned on the technical side and making sure you know everything about technically what to expect with the user interface, I certainly want to make sure that you understand how, the importance of being able to time your answers and understand when it comes to formatting your answers, what is anyone really looking for when it comes to your responses. We're not looking for a quote correct answer in many of these cases, but we want to have your authentic response, and we want to think, and we want to see how you think. That's really the important part of an exam like Casper, and having open-ended responses. The comprehensiveness of how you discern and how you come up with a proper answer, or a proper response, I should say, to a situation is really important to the people who are rating your responses. So we have a situational judgment workshop where we go into a lot of details about some of the things that many of the raters for MMIs in Casper have said that they really feel contribute to a really high scoring response. So one of those things is just making sure that you really consider both sides, or you empathetically consider the person that you're talking to or working with. You are very innovative with regards to your way of dealing with or looking at a particular challenge as needed, and certainly, making sure you maintain professional composure throughout the process, I think, is one of the things that many of the people who rate the answers find very appealing for a higher score. But aside from that, there really isn't much you need to really worry about for Casper. Casper takes a lot of what I will call real life scenarios, and they present them to you to kind of give you a sense of, how would you respond to a specific scenario. And all we ask for you is just to be able to just respond how you would normally respond to such a scenario, whether it's even based on something something similar in your past or not. So again, we do have on our forums an SJT Casper forum where we've had another organization that we partner with they've written about 50 or so different Casper scenarios available. Now, granted, it comes with 3 prompts, and now they've changed the format to be 2. But regardless of that, I think being able to kind of understand situational judgment tests and how the situations really present dilemmas that you have to resolve, I think is really important. And I think it is something challenging to really get a sense of how we make decisions, but it's not as hard as you think it is. So I think with good practice, when it comes to timing, you should hopefully be able to do as well as you can on the Casper. But, all we can ask you to do is do your best and be as honest as you can with the responses that you get.
Okay, thank you. Thanks for the question. And again, if anybody has questions, feel free to put those in the comments. We can pick those up from the LinkedIn feed, the Facebook feed, or the YouTube feed. One question is about getting access to a lower cost version of the situational judgment test. Now, I know these tests aren't quite as expensive as like the MCAT or some of the other tests, but they do still have a cost burden associated with them. So is there anything that students can do to potentially get fee assistance or help monetarily with taking these tests?
So I agree. It's about $100 for taking preview and about $100 for taking Casper. If you did qualify and receive a fee assistance program letter, or especially for Casper, because I think Casper is used very frequently for a lot of the Texas schools. If you happen to demonstrate, I believe you were a participant in their JAMP program, JAMP program. there is a mechanism where you can submit a petition to have your registration fee waived. Now, if you do that, please plan appropriately. Don't just wait till to the day you actually decide to register for your situational judgment test, whichever it is, to petition for a fee assistance waiver. Now, first of all, for Casper, there is on their website, they will go through and they will talk about what the protocols are if you submit a fee assistance program letter, whether it's for AAMC, for ADIA, for if you're doing dental, if it's PAEA, if PAEA gives fee assistance for anyone who's doing physician assistant. VMCAS, I don't know. I think VMCAS does do fee assistance letters as well, but I don't think they have a lot of people in vet schools, but there are a handful that do. So in any case, through Acuity Insights, there's a way where you basically follow their instructions to declare that, hey, you qualify for some waiver or a reduction of your testing costs. So make sure you look that up on the Acuity Insights website and follow the instructions and connect with them before you actually decide to schedule your Casper exam. Now, for AAMC, the AAMC preview fee assistance program is a little bit easier, because if you're granted a fee assistance program waiver already from AAMC, not only do you get your MCAT registration fee reduced, and you get all of the free MCAT prep, you also get a waiver of your preview exam as well, or at least if it's not reduced, it should be waived. So that's actually part of the benefits that you get with the AAMC fee assistance program letter that exists on that site. So make sure that if you haven't done so already, whether you're applying to AMCAS or even if you're applying to ACOMAS, because ACOMAS, they need the MCAT for that too. Make sure that if you ask for and you feel you qualify for a fee assistance program letter, that you do ask for it, because you will get a benefit from that fee assistance program, that eligibility for reducing your costs to take preview. So I hope that helps for how it works for Casper and how it works for preview.
Yeah, that's very helpful, and I think it's important for students to know that they have these options available if they are very resource constrained. We got another question here from Steph, who asks if there is a rubric available for situational judgment tests.
Oh, is there a rubric available? All I can say is I wish if there is one, I wish we could share it with you. They have not made any specific rubrics publicly available, but I'll certainly say from my experience, having developed some sort of assessment rubrics for multiple mini interviews and so forth, it just really, again, I think what helps is understanding that if you want a specific answer, there are certain qualities that we would look for when it comes to if it were Casper, for example, how you look at the situation, how comprehensively you think about it, and again, evaluate both sides, talk about the situation with great empathy. There's a lot there's some things that have been pointed out that the assessors for Casper, the Casper raters, have mentioned, and they pretty much line up with everything that I've always felt regarding a rubric for MMI. So if I did multiple mini interviews, I would have some rating regarding your communication skills. Whether if it's in person, it's a little bit different, because then we can measure your body language. Of course, if it's virtual, it's a little bit more challenging, needless to say. But we could also go a little bit more into detail about how well you structure your answers, how well we look at how well you look at both sides, or how you consider empathetically what the situation is, how well you adhere to or acknowledge certain constraints that comes with ethical principles or guidelines that you normally would expect. So there's a number of different things. It depends on how the situations are all absolutely set up. Now that's for the open-ended responses. So Casper and multiple mini interviews. Preview, again, is a multiple choice test. So the rubric for preview actually comes from a consensus opinion from people who design and review each of the scenarios and each of the possible, each of the prompts regarding, possible outcomes or, possible solutions, I guess, to that situation. All of that is condensed into a 4-point scale from very ineffective to very effective, or maybe it's the other way around on the sheet. And essentially what that rubric is when the people who came up with the questions and are registering it, or at least trying to develop the scenarios, they are given a rubric for what each of the answer choices is, because all the answer choices are the same. What is an effective response? What's a very effective response, and inversely. So all of that is actually included on the sample tests that you receive, that you'll be able to read from the AAMC, where they sort of go through what they consider is an effective versus an ineffective response, and then the extremes, what's very effective or very ineffective. So a lot of that will just depend on, the consensus opinion. And based on that, whether you agree with the consensus opinion or not, that's what counts when it comes to scoring your answers on the preview exam. Now, you can get partial credit on preview, and they clarified it this year for people who are taking the test this year. So basically, your first thing is you have to determine whether a response is actually effective or ineffective. And once you get that, the degree in which you decide whether a response is very effective or very ineffective, if you choose the wrong one relative to the consensus opinion, you'll get partial credit. You won't get partial credit if you say it's an effective response when it's actually ineffective. So I just want to make sure that the rubric does exist in a way for preview in terms of how you score, and you can use their sample test, which has explanations with their answer key to give you an idea of how you should be able to frame looking at the situation in a way that the consensus opinion does. So hopefully that will help you when it comes to preparing for preview.
Okay, I think we're at 42 minutes now, so we'll if you have any other questions, please ask them now in the comments. We have one here that we had prepared, which is, what resources can you suggest? You've already talked a little bit about the SDN forum for Casper. Are there other resources? I know we also had done some articles previously on the professional competencies, and there was the rubric that is available for download for those. So that might be another potential resource. Are there other things that might be good options for students to use?
Sure, and thank you for mentioning the article that we wrote about the pre-professional competencies. Both tests or both assessments look at this, basically the similar combination of all those competencies. But certainly, for AAMC preview, they're really leveraging the 11 pre-professional competencies in a lot of their materials. So again, the preview program was sort of deliberately designed to really put a spotlight on all of those 11 pre-professional competencies that they have on their list. So certainly, as a big resource, you could leverage a lot of the AAMC resources regarding the pre-professional competencies. They have the AAMC Anatomy of an Applicant workbook and those sorts of things. But we also have a lot of other resources in terms of preparing for SJTs. And I think one of the things you have to figure out, first of all, is what are some of the ethical codes of conduct that you are expected to know or have some grasp or understanding. So first of all, do you know your own student code of conduct if you came from an undergraduate institution? Do you know the medical code of ethics, like the 4 pillars of what medical ethics really are about? Do you have a good sense of what is meant by social justice and social mission, and what does that involve, and so forth from there? So I think there's a lot that you can really prepare for situational judgment tests by understanding, what are the expected professional behaviors or professional philosophies you are expected to adhere to. So for many people who have found that they've taken courses in philosophy and ethics and sociology and psychology, they found that many of those courses contain insights that were really helpful for them when it came to preparing for, or at least taking any of the situational judgment tests, Casper or preview. So certainly that resource is available to you too. We also just recently released results from our fall 2024 situational judgment test experience survey. So I would certainly encourage you to look it up on our Student Doctor Network regular website and look up the article. And you can kind of get a sense of some of the questions that we asked, such as, what were the settings of many of the scenarios that you happen to, if you remember, which ones were most commonly used for your situational judgment tests? And hopefully it gives you an idea of exactly what breadth you really need to sort of focus on in terms of how does one assess teamwork. Under what settings do they use it? Do they use it basically in clinical settings? Do they use it as study group settings? Do they or do they use it in like volunteer settings or so? So those sorts of questions we were really interested in, and I would encourage you to look at what we were able to analyze, what our analysis said when it came to looking at those certain situations. So think really carefully about the scenarios that you've had in your lived experiences and being involved in clubs, of having study groups or being in a lab or something like that. Do whatever you can to reflect on some of the challenges that you've had working in teams, working or communicating with others, when there may be ethical dilemmas that you may have had to confront. And those wind up being very useful when it comes to preparing for situational judgment tests. There's certainly a lot of other resources, and we go through a few of them also in that article too. So please feel free to access that article that we published a few weeks ago, and hopefully it'll give you some pointers to help you prepare.
Okay, and for those of you that are on Facebook and LinkedIn, or not Facebook and YouTube rather, those article links have been dropped into the comments feed. So both the two articles, the pre-professional competencies and the fall survey results are in there, as well as the link to the forum, the Casper forum. We'll go ahead and put those in separately into LinkedIn. Our platform doesn't let us just do it automatically. It looks like we've gone through kind of all of our questions at this point, and we're almost at the hour. So I'll go ahead and we can put up our information on our next one. If anybody has any other additional questions that they want to drop in those comments real fast, we can ask another one. But if you want to talk real briefly about what next week is going to be, because we're going to be back online next week at 9 p.m. Eastern, and we'll be answering questions on the mission fit topic. So if you want to speak to that a little bit.
Oh, yes. So mission fit, I'm sure many of you are in the throes right now of really coming up with your school list. Many people who are doing that right now are reapplying. So a lot of the challenge right now is understanding what exactly mission fit is all about. And when it comes to looking at and crafting your final school list, it's not just about doing a big spreadsheet, a spreadsheet filter, looking at grades and test scores and all that other stuff. There's really a lot to be said about how well you understand the mission of each school and what you've done to at least be able to argue you fit into that school because of your mission as well as their mission. So we're going to go over a little bit of that, and hopefully that explains why many people who apply to medical school or health profession schools who have near perfect GPAs, 98 or higher percentile test scores, don't get an offer. And again, from my side of the house, when I've done on the admission side, it is so critical to really get a sense of what you know about your mission fit with the school. So I'm more than happy to, at least at this time, because I know we're really coming up to showtime when applications really start to, when you really have to start submitting your application for 25-26. Mission fit is a very important principle, and I really I welcome all of your questions that will come from that. And certainly, if you know anybody else who has any problems or any challenges trying to understand what it is, I hope next week will be a very good Q&A session.
Yeah, we're looking forward to talking to everyone, and thank you to everyone who hopped in with some questions. We also, if you have questions that you aren't comfortable asking in a public forum like this, we do offer on the SDN site the confidential advice area that's available. It's right at the top of the SDN forums. And thanks to the generosity of our donors, Dr. Chuck also can provide advice on call. So you can find that on our website. If you go to studentdoctor.net and find the information about that, request an appointment. And again, that is all thanks to the help of HIPSA donors. And we very much appreciate the people who support us in that way. So that's all we have for today, but we wanted to say thank you to everyone for joining us. And we look forward to talking with you next week.